Back at UAB in 2003, it was the exception, not the rule, that you were taking care of a gunshot wound. Now we're averaging 2 to 3 gunshot wounds a night.
Dr. Jeff Kirby is the chief of trauma surgery at UAB. As a trauma surgeon, he sees the effects of gun violence every night in the operating room.
Over the last 5 or 6 years, we've seen the doubling of the number of gunshot wounds we're taking care of. It was 350 5 years ago. Now it's 700 a year. Last year was 700.
That increase prompted UAB to expand staffing and resources, meaning it now has 2 full-time trauma surgeons at the hospital at all times. Doctors and nurses are also expanding their reach outside these walls, training people like teachers and school administrators how to respond to an emergency like a shooting.
We don't have to accept the current situation, but we do have to be prepared for it until we find solutions to prevent these active shooter situations that unfortunately happen in schools with some frequency.
Following the mass shooting at Sandy Hook Elementary School, a program called Stop the Bleed was launched. It trains people in the community about basic bleeding control techniques.
We're trying to train everybody because from an injury, regardless of mechanism, if there's bleeding associated with an injury, an individual can bleed to death in 5 minutes if we don't stop the bleeding.
When I sat down with Dr. Kirby, he told me we have to look at gun violence as a public health problem. He also wants to see federally funded research into gun violence to help find solutions.
I'm hoping we can continue to have a conversation in our community about gun violence and hopefully find some common ground where we can really impact and decrease the impact that gun violence has in our community.
An impact that trauma surgeons like Dr. Kirby experience nightly.
There's a huge emotional toll, especially when you can't save somebody. We see the impact it has on families, our fellow staff. We see this, and we just want people to know it's a real issue and that it needs to be addressed.
Dr. Kirby and his colleagues also see that impact on the gunshot victims' families. You heard him mention that, but they're often the ones who have those difficult conversations with loved ones, letting them know a family member will not be coming home.
And you mentioned the Stop the Bleed program. Do you know how many people who have been through that?
Yeah, so I asked Dr. Kirby about that, and he said, while it is unfortunate, they want to give folks the tools and the resources that if they are in a situation, they know how to respond. Locally, they had 41 different events over the past couple of years. They've trained 2,000 people, and UAB presents this to any group in the community, any school. So if you're interested, reach out to UAB, and they want folks to have that information.
Did the doctor have any suggestions as far as solutions before they get to him?
He talked about it being a community effort, that it was kind of a multifaceted approach to getting a solution to this, but doing some significant research into it. That was one thing that he wants to see happen: research into gun violence and then research-based solutions.
All right, thank you so much.